Good afternoon, everyone. It's 2 o'clock and time to start today's briefing. Joining us today, we have Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Office of Emergency Management, Darren Rausch, Health Officer and Director of the Greenfield Health Department, Mara Lord, Senior Vice President of University Engagement and Strategic Partnerships for the Medical College of Wisconsin and member of the Healthy Milwaukee planning team, and Aziz Abdullah, co-founder of InPower, which helped to launch healthymke.com. Mayor Barrett, you're up first.
Well, thank you very much, Sydney, and good afternoon, everyone. I'm very pleased we have an announcement this afternoon pertaining our health department. And as many of you know, for the last several months, Marlena Jackson has stepped in temporarily as our health commissioner and has done a wonderful, wonderful job. And we're very, very pleased with the work that she's done. But we have now designated a new person to be our health commissioner, and that person is Kirsten Johnson. So I'm pleased to announce my appointment of our next commissioner, Kirsten Johnson. Kirsten is a public health leader with more than 20 years of experience in local, state, national, and international organizations. She previously served as the director and health officer of the Washington Ozaukee Public Health Department. She has an extensive history of leadership and service in the field of public health and will bring experience, knowledge, and commitment to the Milwaukee Health Department. Her expertise will strengthen the efforts of our health department as we continue to navigate the many challenges of the COVID-19 pandemic. And again, she's familiar with this, with the work she's done in Washington and Ozaukee County. She's worked in Washington, D.C. She's been part of Congressman Ron Kind's staff. She was involved with the Robert Wood Foundation. And so she really has an extensive background. And she's joining an already very, very strong team. Obviously, we are very grateful to Interim Commissioner Marlena Jackson for her work leading the department through most of the current pandemic. And she has stepped in without a doubt the most challenging time for anyone to step forward, and has been truly magnificent. So she has stepped back during this challenging time, and again, as I said, has done a phenomenal job. So I'm happy to share with you that Marlena will continue to remain with us and will continue her work with the Milwaukee Health Department as a deputy commissioner. But I will be forwarding Kirsten's name to the council. The council, of course, has to confirm this appointment, but we're eager to have her talk to the community and talk to the members of the Common Council. So that's big news for us today at the City of Milwaukee Health Department. I want to share that vaccine distribution at the Wisconsin Center for the City Group 1A individuals is continuing to go smoothly this week. So segue from Kirsten to the vaccination that we're seeing. Of the 800 doses, we have used 614 since the beginning of the week. So it is coming in and it's going out just as fast as it's coming in. Most of these were given to individuals from the 1A affiliated group. So a good amount of these doses are going to the 1A affiliated group. For those of you who are not familiar with that, those are going to be places like dentists or physical therapists who are not associated with one of our healthcare systems and are not city employees. The Milwaukee Health Department has contacted our first set of pairings made by our Healthy MKE Connector tool, which you'll hear about in just a bit. This is an online asset that allows both vaccinators to register with the city, as well as people who are looking for the vaccination. So it's a matchmaking device made right here in the city of Milwaukee, and we're very pleased to be able to roll that out this week as well. I'm also pleased that we are now moving to our second group. Next week, we anticipate receiving 3,000 additional doses of the Pfizer vaccine from the state of Wisconsin. So we went from 100 to 800 now to 3,000. So I think you can see that this is picking up very, very quickly. But again, our experience at the Wisconsin Center this week has been very, very positive. As I've been over there several times, you see people going in and going out, and it's moving very, very fluidly. And that's exactly what we want to see. We're eager, of course, because it is not open to the public right now. We are eager to get it open to the public, but please stay tuned as we move through these designated groups. And people should understand that these groups are designated by the federal government and the state government. And so we don't have the authority to basically deviate from this in a significant way. So we are following the state lead on this as it interprets the guidance that it receives from the CDC. But I want to go back to the healthymke.com because, again, this is an important tool. And I'm pleased to be part of a rollout of this new website, healthymke.com, that will serve as an online source of COVID-19 information and other health resources for vaccinators, for public health officials, for partner organizations, and most importantly, I think for people listening here, for residents as well. One key feature of the site is the Vaccine Connector tool, which helps match individuals and organizations identified as phase 1A, which is the phase we're currently in, with registered vaccinator organizations capable of administering the vaccine to them. So again, it's a matchmaking tool. You have vaccinators who register with healthymke.com. You will have individuals and organizations that are looking for the vaccinations, and this allows us to bring these two together. The City of Milwaukee Health Department has capacity, so if you are part of 1A, please log in to use this tool. To reiterate, this is right now for individuals and organizations that are part of phase 1A. As the pace of vaccine supply and distribution increases, and we hope it increases dramatically, the website will ultimately provide real-time updates on the phases of vaccine eligibility, as well as locations in Milwaukee County where vaccine administration occurs. Now for an update on the testing. Again, one of the other fronts that we're fighting this war on, the testing as of yesterday, Wednesday, January 13th, we had 838 at the American Family Field, the former Miller Park. Those numbers are lower than I want them to be, and Dr. Weston might comment on that. Our Northwest Health Center was solid with 422. The Southside Health Center had 229. And in South Milwaukee, the South Shore site had 237. So for the week, we're closing in very, very quickly on 5,000. I'm sure we're already over 5,000 for the week, but these numbers are still much lower than we'd like them to be. So when in doubt, we urge individuals to be tested. Now to segue to Martin Luther King Day, I want to remind everyone that this coming Monday is Martin Luther King Jr. Day. And there have always been some really wonderful events in our community. It's always historically been one of the busiest days in the year for me, from the YMCA breakfast to the work that's done by our library to community activities. It's traditionally been a day on, not a day off. But this year, thanks to the creativity of our Milwaukee Public Library staff, we are still able to celebrate his legacy virtually. So I encourage everyone to visit mpl.org to learn about this year's speakers and programming, which includes a daily youth trivia contest hosted by Alpha Phi Alpha and a social media art contest as well. You can also join the YMCA of Metropolitan Milwaukee for virtual programming on MLK Day. So take part in their deliberate dialogue discussion series, as well as their youth programming, which includes a film presentation and a group dialogue. And after what we've gone through in 2020 and the start we're off to in 2021, I think that these deliberate, thoughtful dialogues are probably more important than they have been literally in generations. So more information is available at ymcamke.org. And as I said, now more than ever, we need to embrace social justice and racial equity. And that's in part because the disproportionate effect of COVID-19 on communities of color is just one reminder of the work that remains ahead of us. Again, as Dr. Weston has said, and as the commissioner said, if you look at our communities of color, often that's where we're seeing the highest incidence right now. Certainly we saw in the onset of this very high mortality rates in the African-American community. We've seen high incidence in the Hispanic community. So these social determinants of health have had a real impact on everything that we're trying to do here. So again, a lot going on, a very, very busy week. We're very, very pleased, as I said, with the work done on vaccinations. We're continuing to work on testing, the outreach on tracing. So giant shout out to all the people over at the health department, as well as our partners at the state and the county. And with that, I'm going to turn over to one of our strongest partner, County Executive David Crowley. Mr. County Executive.
Well, thank you so much, Barrett, and definitely appreciate your partnership and your leadership throughout this pandemic. And as the mayor mentioned, Monday is Martin Luther King Jr. Day. And there's so much of Dr. King's life that was about service and really giving back. He famously said, everyone can be great because everybody can serve. And in the spirit of that service, this Monday, January 18th, the Milwaukee Community Resilience Response Team is sponsoring a food giveaway and COVID testing event at the Lovell Johnson Quality of Life Center. This is a free event. It's going to take place from 11 a.m. until 3 p.m. And it's going to include an on-site COVID testing, free basic foods, free t-shirts, and more. And everyone is welcome to join this event. And for those who are able, I encourage you to think about what you can do to serve others on this day, honoring Dr. King's legacy. And the center that we're talking about, the Lovell Johnson Quality of Life Center, is located on 15th and Atkinson. But in a couple minutes, I know that Dr. Weston is probably going to discuss more about the recent enhancements that we have made to the county's COVID-19 dashboard. These updates include additional data around the status of vaccine administration right here in Milwaukee County. And I want to say thank you to the state for providing this data, which will be used to inform us on decisions that we're going to have to make. And I'm thankful for the state's partnership and hope that we can continue to work together to get even more detailed data. This vaccination data will provide a clear picture of how many residents are being vaccinated, their race and ethnicity, and the ages of those receiving vaccinations, and more. And these enhancements are a step in the right direction so we can have greater transparency for our Milwaukee County residents so they know exactly what is happening in their own communities. And in Milwaukee County, we want to continue using this data to make better informed decisions to achieve racial equity and again become the healthiest county in Wisconsin. And this is just one way we're working to achieve that goal. And lastly, I'm excited about the launch of healthymke.com, as the mayor spoke about. And I've spoken about this before, but there is value in these public-private partnerships. Throughout this pandemic, they have shown value. And this is a prime example with this particular launch of healthymke.com. And this is sponsored by the Milwaukee Unified Emergency Operations Center and supported with resources from organizations like the Milwaukee Healthcare Partnership, the Medical College of Wisconsin, and others. And Healthy MKE is well positioned to provide reliable, timely vaccine information to our community. And so I want to be clear that this is not to sign up for testing or to sign up for vaccinations. This is for you to be able to access information related to that. And so I just want to say thank you all for joining us again. And I'd like to hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First, to our numbers, we have had 90,277 confirmed cases of COVID-19 in our community and 931 individuals who have died in Milwaukee County. And I'm pleased to be able to report that as of the last data poll from earlier this week, we've had 21,728 doses of vaccine that have been received by Milwaukee County residents. I'll circle back in more details to those numbers shortly. In our overall trends, we're seeing a leveling of our percent positivity and a steady decline in hospital utilization from COVID-19 patients. These are both great signs for our community. However, it can't be emphasized enough that testing is still key in our efforts to fight this pandemic. Our testing sites are underutilized. And that means that you can get a test extremely easily and quickly at our testing sites. So please go to TestUp MKE to see the testing criteria, the testing sites, and find one near you. And related to TestUp MKE, we have Mara Lord from the Medical College of Wisconsin and Aziz Abdullah from InPower joining us shortly. And they'll be discussing the launch of the Healthy MKE vaccination website. So this website, which they and many others have done a really outstanding job designing and implementing, will allow not only for the effective dissemination of vaccination information for our community, but it's already allowed for and facilitated a streamlined process of connecting those in need of vaccine to those providing it. So more to come on that soon. I'm going to share my screen here just real briefly to show the COVID dashboard. There we go. So this is our vaccine dashboard with the vaccine numbers. So this is a new public-facing tab on our county COVID dashboard, and it's based on data provided by the state. And we're certainly thankful for their partnership now and really throughout the pandemic. So you can see the tab at the bottom of the dashboard. It's between hospital capacity and the municipal trends tabs. And importantly, this tab is in its early stages, but it was important to us to get this data out as soon as possible to transparently inform the public as well as stakeholders of where we as a community are on vaccinations. We certainly expect to get much more detailed information in the future to help us, for example, to separate out first and second doses of the vaccine. We can't do that right now with the data we have, as well as to better understand the gender and geographic distribution of vaccinations. But this is a great start toward understanding what's going on in our community. And we're working with the state to receive more in-depth, more frequent updates. But for now, we're thankful to be able to update this tab once weekly. We'll do that on Wednesdays. And the data currently there was updated through last Monday. And of note, when reviewing this early data, nearly 22,000 doses seems to be approximately in line with what we would expect proportionally for our county based on the percent of the population in our county that comprises compared to the state. Now that said, we'll look forward to further data to better understand how our county is doing relative to other counties in the state, and for that matter, other metropolitan areas and other states in our country. Additionally, much as we did with our main COVID dashboard when it was first launched back in the spring, we want to be transparent about the equity with which the vaccine is distributed. At the moment, we see on the dashboard clear challenges with disparities. Of course, early on, much of this is inherent in the demographics in the 1A population that has been vaccinated so far. Now, that said, we certainly recognize the equity challenges inherent in vaccine hesitancy, as well as the burden of disease from COVID in our populations of color. And we'll continue to actively outreach to all those communities, but especially those that are historically and institutionally underserved, and certainly keep a close eye on the race and ethnicity numbers as we move forward in the vaccination process. In the meantime, the state has announced that we're able to begin transitioning to our law enforcement colleagues next week as we move to the first part of phase 1B. So this is an exciting development. It'll start on Monday and a promising step as we move through our population to get as many people vaccinated as fast and efficiently as possible. Thank you very much. Stay safe, and I will hand it to Director Rausch.
Very good. Thank you very much, Dr. Weston. It's my pleasure to join today. My name is Darren from the City of Greenfield Health Department. Just want to start today, like other weeks, talking about a few overarching themes. The data continues to support a continued increase in COVID-19 cases countywide this week compared to last week. The data has trended up in the most recent weeks, and yet we know testing is still very low and much lower than we've anticipated in the past. The continued increase is also seen amongst the children population. So we're not only seeing an increase among adults in the entire population, but also among children 18 and under. And it's important to note that any potential increase, any bump from the New Year's and Christmas holidays in late December would definitely start to appear this week and next. Secondly, I want to just kind of start off by talking a little bit about COVID-19 vaccination efforts. These efforts are underway, and unfortunately, vaccine supply has been one of the most limiting factors in how fast we can move vaccination forward. We know that the supply from the federal government has been limited in coming into the state and has been the chief limitation getting shots in arms. We anticipate greater availability with some of the federal announcements this week on vaccine. And furthermore, we anticipate more points of access for vaccine in future weeks. Local public health was never meant to be doing all of the vaccination. And we anticipate that other partners across healthcare systems, clinics, pharmacies, and others will be joining to start vaccinating as we move forward into future phases. And lastly, we know that you as the public are interested in knowing where you can get your vaccine and when you can get vaccine and have questions on vaccine. So I'm very excited to hear from healthymke.com later in this briefing so that you can know and be aware of that resource that is available to you in the county. So with that, I'm going to go ahead and share my screen so we can take a look at the data for this week. All right, so here you see figure 1. We're looking at daily number of cases of COVID-19 since the beginning of the pandemic back in March. We all know and are very well aware that we had a very high peak in November, and we've largely been going down with a little blip here in early December. And really since the Christmas holidays, it looks to be about December 26th here on this figure, we have started a gradual increase in the number of cases. Now, some of that could be related to the fact that there was very little testing around the Christmas holidays with testing centers closed, but it also could represent an increase in circulating disease. Certainly, in some other data that we're going to see shortly indicates that it might be a combination of both. And again, transmission rate is another factor that we'll look at, and that has also been showing indication that there might be more disease circulating. So moving on to deaths, we had seen a large spike of deaths, particularly in mid-November, particularly in the suburban communities, and we're starting to see that taper off. Of course, deaths, as we've mentioned before, is a lagging indicator, and sometimes it takes a few weeks for these deaths to be reported. But that is certainly something that we are watching very, very closely. Talked about the reproductive number, and that's the number that tells us how transmissible the disease has been based in data. And that reproductive number, or that transmission rate, has been largely above 1 since right before Christmas. It looks like December 24th, 23rd. And a number above 1, as a reminder, means that there are more people getting infected from every 1 case that we're identifying. And this is a trend that we don't want to see continue, even in the world of vaccination now being available. And this graph, if I show here, we see city of Milwaukee on the top and suburban communities on the bottom, very similar trends. It looks like the suburban communities might have a little bit of a higher transmission rate than the city, but certainly both are worrisome. Actually, the demographic information has stayed the same week after week. We are seeing a larger increase in the Asian American population, the orange line here, in terms of cases growing in that subpopulation, and that's something that we want to pay attention to. A few months ago, we saw a significant increase in the American Indian population and Alaskan Native population. So these are trends we're going to be continue to watch very, very carefully. I mentioned testing, and Dr. Weston had mentioned testing as well. We are seeing a decrease more recently. Again, we're averaging probably about 25,000 tests a week for the last 2 weeks. Data's pending for this week, so I'm hopeful it'll catch up. But it's a far cry from where we were in early November, where we were seeing almost 45 to 46,000 tests per week. The trend in terms of positivity has been decreasing, but again, I always want to interpret this data with caution because we know the last several days worth of data is preliminary until we get all of those test results in. Lastly, let's look at a few maps. We'll look at first the confirmed cases of COVID within the last 2 weeks. This is looking at a time period of December 30th through January 12th, and I'm sorry we're missing a 1 at the end of the year here, but you can see any areas that are orange and red are indicative of higher disease, and we are seeing disease throughout much of the county. Additionally, we can look at testing rates, and testing rates over the last few weeks. Again, areas where testing is high are red, so we're seeing a lot of areas where testing is high, but unfortunately we're seeing areas that are not testing at a very high level. And that's worrisome because we know testing is available and people are able to get their tests. So with that, I will stop sharing. And I just had a couple, comments as we talk about the pandemic and the role of public health and the public health system. As I shared earlier today, because I was able to speak as part of the Assembly Committee on Health testimony about vaccination, public health has been preparing for pandemics for a very long time. We've been working very closely with our community partners, fire, EMS, healthcare clinics, pharmacies, and we're well positioned for success with our vaccination efforts, continuing strong partnerships and continuing to have access to vaccine, human resources, and other tools that we need to do the work that we're going to do. A tool like healthymke.com is an excellent communication tool that helps drive information to our public and helps drive the public to our clinics. The work that we need to do in vaccination is not easy, and there'll be continuing to be challenges going forward. But we've accomplished a lot so far, working collaboratively across Milwaukee County, and I believe that we can continue to have great successes going forward. The commitment across the county underscores how important the COVID pandemic is and how important a strong coordinated response is for Milwaukee County. We have great partners across the county, and they've really stepped up and have been working together with public health and others for months. We're months into this, folks, and vaccination planning and clinics that have started this week and last week really do provide a glimpse of the light at the end of the tunnel in controlling COVID-19. So I thank you for your time and attention. I will now turn the briefing over to Mara Lord to talk about healthymke.com. Thank you.
Good afternoon. Darren, thank you so much to you and to all public health officers across our region. We are so grateful for your commitment and for your work. I am Mara Lord, here as a representative of the COVID-19 Vaccine Coordinating Committee, which has been established as part of the Unified Emergency Operations Committee, or the UEOC. And as County Executive Crowley reminded us earlier, the UEOC has coordinated a unified multi-sector public health response to COVID-19 with a focus on vulnerable populations in Milwaukee County since the beginning of the pandemic. You know, listening to everyone who's spoken before me, the message today is just so consistent. The effort to swiftly get vaccines out to Milwaukee County residents has hastened the need for a coordinated response. And the Vaccine Coordinating Committee is implementing and organizing an equitable COVID-19 vaccination plan for the residents of Milwaukee County. And it's just taking so many people to do that in a very short time. And as you can imagine, and I'm sure you're feeling each day, thoughtful and relevant communications, outreach, and engagement are really essential to a coordinated and equitable distribution and to addressing the infodemic that we continue experiencing. A really talented and integrated team of individuals from our community and representing the City of Milwaukee, Milwaukee County, Milwaukee Healthcare Partnership, Medical College of Wisconsin, and InPower have been working in partnership to stand up resources that supports the outstanding work of public health officers and approved vaccinators across our community. As Mayor Barrett and Dr. Weston mentioned earlier, we launched the Vaccine Connector tool to identify and link organizations approved as DHS vaccinators with individuals and organizations eligible to receive that vaccine in phase 1A. And to date, more than 2,800 matches have been made using the Vaccine Connector tool. It officially launched less than a week ago. So we're very, very pleased to see that this tool is working. More so, we're excited to share that the site that you've now heard a couple of times, I say my talking points were made for me as healthymke.com was shared many times in this press briefing so far. But we are ready to scope this beyond the connector tool and expand real-time information and resources on vaccines and much more. Healthymke.com is a resource that I truly hope supports and uplifts the many valued voices of our community and enables conversation, connection, and informed choice. And with that, it is my pleasure to turn this over to Aziz Abdullah, co-founder of InPower, to walk us through healthymke.com.
Thank you, Mara. Can you guys hear me? Mara, give me a thumbs up. I can still see you. Oh, good. Thank you, Sydney. And again, thank you everyone who's had the opportunity to join today. My name is Aziz Abdullah, and as Mara Lord mentioned, I'm one of the co-founders of InPower. We're an agency based in 53206 here in Milwaukee. And over the last 6 months, we've had the pleasure of working alongside and in alignment with the Milwaukee Healthcare Partnership, as well as other collaborators to work effortlessly to ultimately, or tirelessly to ultimately get testing information out to our community. And towards the end of the year, as many of you all know, the announcement of the vaccine became readily available. And one of the priorities that we really wanted to reinforce is the importance that we work in a space where we don't duplicate efforts, but there's not an infodemic where people have to go to 5 different places to be able to sort through information. And so in elevating some of the points that were made today, our goal is not to duplicate efforts, but to be able to connect to existing resources that are available within the community as it relates to COVID-19, and at the same time work to make sure that our community has facts and that it is user-friendly and delivered in a way that ultimately is in alignment with what we know our community needs. So before I just do a screen share, I just want to share that the website will be available in multiple languages, as was Test Up MKE. And we have also made sure that we have ADA compliance associated with the website for our brothers and sisters in the community who use the online and technology in a different way that we are right now. So I will share my screen. And as elevated, last week we were able to launch the Healthy MKE connector tool. And so again, this tool is specifically for community members that are in phase 1A, both for individuals and organizations. You read the term here, unaffiliated on the website. What that essentially means is you may have a independent traveling nurse who is, on the front lines providing resources to our community to keep people well, but may not be a part of a health system. Individuals like that, as an example, have been able to go on here, get registered, and ultimately get connected to vaccinators, as Mara mentioned. Again, our community has also been able to get information about phases and what phase they may potentially fall in based on today's current information. And so as elevated, we've had over 2,600 connections as it relates to individuals and organizations to vaccinators. And we've also had 1,500, and I'd say growing, individuals and community members that are not a part of phase 1A, but have signed up to be able to get alerts. And of course, one of the first alerts that will be rolling out is the fact that the full website experience is live as of 2:00 today. And so again, I'll just do a homepage walkthrough and talk about a few of the elements before we close out. One of the things I just want to note is we always make it apparent when the site was last updated. It's really important to make sure that we keep people informed with information that is accurate. And as many of us know, this is a dynamic space. And so making sure that we stay consistent with that. Getting information about FAQs, the phases, and how to get connected. And again, I just reinforce, this is not a registration process for the vaccine, but this is a connector tool to be able to create efficiencies across sectors in this space today. Additionally, just some bottom line key messaging available for community members to be able to access and ultimately introduce and start to be able to create a little bit of education in a way that many of us are able to consume that may not be in the traditional modality. And then breaking down information about phases. A big question that we got in the early stages of just developing work and starting to wrap our arms around the communication space is who's involved, at what level are decisions being made. So making sure that we represent not only what is considered in this space to be a global ecosystem, but ultimately representing our Milwaukee area as well. Additionally, we will be featuring community events that ultimately are getting our community educated around COVID-19 vaccine information as well as COVID-19 response. And one of the things I'll just reinforce is that even though the vaccine is readily available, it is only for phase 1 individuals and organizations today. And so having the opportunity to work in alignment with the work around Test Up MKE, we continue to reinforce the 3 W's: wearing your mask, washing your hands, and watching your distance. And that will be an integral part of the messaging around Healthy MKE as well. Again, we connect to additional local resources, both that address the social determinants of health, as we know many people in the community who've not only experienced impact as relates directly to the pandemic, but ultimately livelihood, making sure that there's available resources that are accessible on the website. All 11 health departments are also reflected and directly connected to the website, and then making sure that we connect to the data that's available in real time. And so again, one of the last points I'll just close with is the fact that although this has been primarily stood up as a responsive tool and been able to support around the COVID-19 vaccine response and other resources, it's also important to make sure that this has been developed in a way where over time it has the opportunities to make sure that other resources related to health are available. And so even as much as flu information is currently on the website, is we are still in flu season. And so I appreciate the opportunity, and we will continue to work alongside the great partners who have been doing this work. And thank you guys for your time today.
Thanks so much, Aziz. Our first question from the media comes from Nick Bohr at WISN 12. Nick is going to ask his question on camera, and this is for Dr. Weston.
Thanks, Sydney. And I don't want this in any way to sound like I'm pointing fingers or anything, but we have been getting emails about a lot of them, about people seeing on social media, about people who are working IT or volunteers or who don't have any sort of contact with patients, but they do work for a hospital or medical group, getting vaccinated and setting up appointments, not just having like leftover vaccine. Could hospitals have done more, or can they do more to try to reach out to the 1A people before going to some of these other employees?
So I'll tell you, I've seen those same reports. I don't know all the details about them. What I can say is that I know our hospitals have, the ones I've talked to have worked very hard to reach out to the unaffiliated 1As. So certainly working to get the 1As within their system, and then reaching out to our EMS system, reaching out to private clinics, working out to dentists. I think you'd have to reach out to the hospitals to get those specifics, but I think they've been working very hard to get vaccine to the 1A providers that need it.
Our next question comes from Rich Ravito at Milwaukee Magazine for Mayor Barrett. When do you expect the Common Council to vote on Kirsten Johnson's appointment, and do you expect any resistance to the appointment?
Well, I will be introducing it formally in the next day or so. So it'll go through the normal cycle. So we'll have a hearing probably within the next few weeks, and it's my hope within 4 or 5 weeks they will have her confirmed. I can't predict right now whether there'll be opposition. I certainly hope not. We know that she has an extensive background, and in addition to that, she was chosen through a vetting process that really comprised members of our health board, community members. So it was a very thorough process that allowed her to be chosen. She's already begun scheduling meetings with members of the Common Council. So I anticipate that she will pass. But again, I've been wrong before, but I'm confident that she'll make it through the Common Council.
Our next question comes from Brittany Lewis at CBS 58 for Dr. Weston and County Executive Crowley. How many people are in Phase 1A in Milwaukee County that you would estimate still need to receive the vaccine?
Well, what I can say is that with Milwaukee County employees, we do have about 450 nurses and medical staff all across all of our departments. And there are about 200 that needs to still be vaccinated within Milwaukee County employees. But based off of the state data, I think there are about 75,000 individuals who fit within that 1A category throughout Milwaukee County, and that's not including Milwaukee employees. But I don't know the exact number on that. Maybe Dr. Weston can just step in a little bit.
No, I think that's a pretty accurate estimate from what we know from the statewide numbers. And really, this is one of the assets of the Healthy MKE website is we don't know of every individual provider, every patient-facing nurse and dentist and everybody who's out there. And so we've certainly heard from a lot of them through this website, but we're hoping to ensure that everybody who needs a vaccine in that 1A group gets matched up with an appropriate vaccinator.
Our next question comes from Ashley Sears at Fox 6. With new restaurant restrictions set to expire tomorrow, what will the restrictions look like moving forward? Will the city go back to Phase 4.2? What does that entail?
Yes, it will return to 4.2. And I'd say the major difference is if you have an approved plan, you'll be able to go to capacity. If you don't have an approved plan, you'll have to stay at the 25%. But we have had a lot of good compliance with restaurants and bars, for that matter, who have submitted plans. And so if the plans have been approved, you'll be able to go to the capacity that you're allowed to under the current ordinances.
Next question is from Ben Wagner at WISN. On the county's vaccine data, why has the 25 to 34 age group received the highest number of doses? Also, does the Milwaukee County have any specific plans to address any disparities in who gets the vaccine?
Yeah, so I think there's two trends that we're seeing right now with the preliminary data on the dashboard that will hopefully and quite probably change in the coming weeks. So one is that the vast majority of people being vaccinated right now are white. And the other one is that the vast majority of the people being vaccinated right now are in the younger age groups. I think both of those to a large part are inherent in that 1A group. Now, what's going to be key is keeping an eye on both of those figures as we expand out to 1B and 1C and ensuring that, number one, we're equitable and having active outreach both in our municipalities as well as in the county to all different racial and ethnic groups to ensure that we have an equitable distribution of vaccine. And on top of that, to ensure that we have an equitable distribution for age groups, that it's easy for people of all ages to get to our vaccination sites and get vaccinated. So I think those are trends that will hopefully change in the next few weeks. I think they will. I think this is because we're looking at very early preliminary data and it's naturally skewed by that 1A group, but it'll certainly be something to keep an eye on.
And if I could weigh in here, this is a major concern that I have that, and I contacted the state on this very issue. We've gone through 2020 where there was a lot of social unrest about racial inequities, and we've talked countless times on these calls about the social determinants of health, the negative impact of this pandemic on the African-American, the Hispanic community. And I think it would be a grave injustice if in the distribution of vaccinations that we went back to the old standby that perpetuated these inequities. And so I have specifically asked the state to address these concerns in the distribution of vaccinations. We have to make sure that there is a equitable distribution of these vaccinations. And I think all of us, probably everybody on this call agrees that if you look at the people who need the vaccinations the most, if you look at the highest mortality groups, that those are the ones that should be at the front of the line. They shouldn't be for healthy young people who are working remotely. It should be for people who really are faced with some serious health challenges. So I am going to continue to monitor this. I had the same reaction looking at the first reporting, and I think all of us, everybody involved in this, has to be mindful that we don't perpetuate these inequities.
And I would just to echo the comments of Dr. Weston as well as the mayor, we're continuously talking to the state about making sure that there's an equitable distribution of this vaccine. This is something near and dear to us, but this is directly in line with our mission and vision of being the healthiest county by achieving racial equity.
Our next question comes from Allison Durr at the Milwaukee Journal-Sentinel. Mayor Barrett, to clarify, has the city started providing any of the vaccine at the Wisconsin Center to those in the 1A group who are unaffiliated, or have the 614 doses this week all gone to city employees? If none have gone to unaffiliated people, or
no, they have.
Sorry.
Yeah, they have begun unaffiliated. In fact, I was there Tuesday at about 1:30, and they were calling unaffiliated at that time because they had at the end of the day some additional vaccinations. So they were literally making calls to unaffiliated providers to make sure that they could get there. So that began on Tuesday and it continues through today.
An additional question from Allison Durr. Now that the more contagious strain of the virus found originally in the UK has been found in Eau Claire County, is Milwaukee County taking any additional steps to determine whether the strain is here as well? And what does it mean for the local response?
Yeah, so there are certainly efforts at the state level and at the city level to see whether the strain is here as well and to see if other strains are in our community. Now, I think what's important not to lose sight of is prevention of the UK strain and the South African strain is the exact same as prevention from the COVID that we saw months ago and that we continue to see. And that's the personal precautions. That's physical distancing. That's wearing a mask. It is more transmissible, certainly. It doesn't appear to be more severe or more deadly, but nonetheless, it's more transmissible, and that's extremely concerning. So it just really emphasizes how important masking, physical distancing, and getting tested if you have symptoms or close contact with somebody who tests positive.
We have just a few more questions left in the chat. If anyone else has questions, please make sure that you're entering them into the chat box. The next question comes from Mary Jo Ola at TMJ4. What will the rollout for police and fire look like starting next week? How will it be organized?
Well, one of the things I think that is unique about Milwaukee is that virtually all of our firefighters qualify as emergency medical personnel because of their training. What that means in practice is that we are basically working very, very quickly through the fire department. So I anticipate that those from the fire department who want to be vaccinated will be vaccinated if they haven't been vaccinated already. So that means that we'll be beginning with the police department, and we'll be working with the chief and with the districts to make sure that we have a good distribution plan there. But again, for the most part, the firefighters will have been taken care of in 1A, and then we'll begin with the police in 1B. And that's a larger group. We've got approximately 1,800 people who are sworn officers in the Milwaukee Police Department, and then there'll be others that have daily contact. But again, we want to put a priority on those who are interfacing with the public more than anything.
Our next question is from Taryn Powell at WUWM. Any ideas what might be contributing to the rise in cases in Asian communities around the county?
I can start on that. So we have seen probably over the last month or so that the Asian community has slightly, not terribly significantly, but has slightly taken off higher in the percent positivities compared to other communities. Now we know that as we've seen in other communities of color, other underserved communities, a lot of times there are certainly health disparities. And so through active outreach, through targeted messaging, and through availability of testing and vaccination, we're hoping to monitor that and continue to address it.
Last call for questions from the media in the chat. An additional question from Allison Durr at the Milwaukee Journal Sentinel. How many city employees have received the vaccine at this point?
Again, the bulk of those in 1A have been city employees. I think Commissioner Jackson is on the call. I'll ask her to comment, but we have been doing some affiliated, but the bulk have been those who work for the city. But Marlene, if you want to address that.
Thanks, Mayor. So yeah, we're at about 500, including the frontline staff in the health department and the fire department.
An additional question from Taryn Powell at WUWM. If testing continues to decline, what can city health leaders do? Does messaging change? Are you worried?
So I can start and share that, our goal is to continue to test. We know that it's one of the best ways to do that. So I think it's a matter of being more creative and figuring out how do we identify where and how we can test more and better. So I think that's just a matter of looking at different reports and doing a little bit more outreach to get to individuals and individual communities and groups that we can test at a higher rate.
And just to expand on the second part of that question about whether we're worried, I'll say for myself, absolutely. We've seen around the country, Arizona is a good example. They had extremely high levels of cases a few months ago, and then they went into a bit of a lull, and things were looking better now. And now we see that Arizona is faring worse than any other state in the country, and in fact, any other part of the world. And so COVID can come roaring back without much notice. So it'll be a while until we have the level of vaccination where it's really going to tighten up our percent positivity and our number of cases. And there's no reason to think that in the next few months we won't see another spike. So testing remains as important as ever.
Another question from Mary Jo Ola at TMJ4. I know we gave this number earlier, but can you clarify how many people in our local group are in our local group 1A? And how many people in that group may be left to be vaccinated?
So the best number we have to work off of is the state estimate right now. And based on the state estimate, when you take that population as a percentage for Milwaukee County, it looks like we probably have around 75,000 1A individuals. Now, with the data we have, it's for both shots, so it's a little hard to parse out. I think the important point is that we're trying to gather up all those 1A individuals, whether we're a third of the way, half the way, 2/3 of the way. It's probably, if you look at the numbers, a good guess would be maybe a third of the way through the 1A group. But this Healthy MKE website will help to identify all those 1A personnel who want to be vaccinated. And it's also important to remember there is some vaccine hesitancy out there. We're trying to overcome it. It's an extremely safe, extremely effective vaccine. But just because we have 75,000 1A personnel does not mean necessarily we can get 75,000 shots in the arms.
A question from Allison Durrett, Milwaukee Journal Sentinel. Dr. Nick Tomorrow said earlier this week, officials anticipate 800 to 1,000 city employees were in the first group. Why have only 5,000 been vaccinated? Have the other 300 to 500 opted out?
So we actually have clinics that's running today, tomorrow, and on Saturday. So that 800 to 1,000 number was given. We have a few more days to get that done. But yeah, I think one of the things that as public health we are concerned about are the number of individuals that have hesitancy to get the vaccine. And so again, we'll continue to message and get as many people vaccinated as we can.
Another question just came in from Nick Bohr at WISN for Dr. Weston. Are you surprised at all at the level of vaccine hesitancy?
I'm not sure I'm surprised at the level of vaccine hesitancy. I certainly hope the number will go down in the coming weeks and months. I think that it seems to me there's three groups of people when it comes to the vaccine. There's folks, admittedly, like myself, who when the vaccine's available, I'll tell you, the minute I got that email, I signed up as quick as I could to get the vaccine. And then there's folks at the other end that for whatever reason have beliefs that they are not going to get the vaccine no matter what happens. But I think there's a whole lot of people in the middle who want to wait and see, want to see how it affects those who are getting it. And a lot of people, myself included, have gotten the 2 shots, are doing well. I didn't mention on Tuesday, I had no side effects from the second shot other than a little bit of a sore arm. And most colleagues that I talk to have the exact same experience. But regardless, I think there's people who are in that true hesitancy group. They're not quite sure. And my hope is that when their time comes, whether they're 1A, 1B, 1C, or group 2, that they'll be comfortable getting the vaccine, not just because of the tens of thousands of people who have been studied who received the vaccine, but from the millions of people more who soon will have received the vaccine with minimal side effects.
And I think it's human nature that you're going to have a number of people whose attitude is going to be, oh, after you, why don't you go ahead and you be the one to test it? And as more and more people are tested and it's successful, I think that's going to change. So it's not as though we've seen this refusal rate being high. We just haven't had as many people signing up. And I think that number is going to change as more and more people are tested, and they're going to listen to the people they work with. And if the people they work with, that were the ones that are like Dr. Weston, who are eager to get it, say everything is great, that's going to be the biggest selling point, I think, for those who are hesitating right now. So I'm not concerned with it. I think you're going to have a number, but there is going to be a group. There clearly in society is an anti-vaccination group out there. But I think the more success we see with this, the more people will get the vaccination.
And just to echo those same comments, the mayor and I and many of this call, we talked about making sure that people become comfortable taking this vaccine, but we're going to continue to message to folks about the importance of taking the vaccine, but also talking to folks to make sure that they're making the best decision, not only for themselves, but their families as well.
And with that, that was our final question for the briefing today. Thanks for joining us, everyone. We'll be back here again on Tuesday.
Thanks, everyone.
Thank you.